Thank you, Kong Stella. Before I recognize Yusek Vega, I share the sentiment of Kong Stella. Calling the One Hospital Command, I think na-heads up ko na po ang DOH on that based on my personal experience then, no? Medyo mahirap pong maka-access. But, and then I also agree with the recommendation of Kong Stella to tap on the private hospitals or clinics, especially in the ground, so that we can utilize their services, no? But I also agree with Secretary Duque on patient navigation should start from the local government unit, no? Ako, based on my experience, Sec, every day I've been like navigating 20 or the most 30 patients a day. These are patients who are at home or in the district and provincial hospitals. Siguro lang, we want to ask then the DOH on how we can help capacitate the local government hospitals, the municipal health units, and compel them to follow the proper referral system. Kasi most of the patients talaga, pag sinabi na hindi nila kaya, walang capability ang hospital, burden ng patient to find another hospital where to go. So, wala talagang nag-a-assist sa kanya. Actually, yan yung isa na benefit should be doon sa universal healthcare law natin. But, kailangan talagang paigtingin sa local government unit po yung tamang pagkalinga at pagmamalasakit sa pasyente. At ituro sa kanila papaano gawin yon. Kasi marami po mga government hospitals sa local, hindi talaga po nagna-navigate. I can attest to that. Araw-araw po yan ang aking kinikater eh. So siguro lang dahil hindi alam ng pasyente saan pupunta, kaya nangyayari po ito, no? And the One Hospital Command should be a good platform po, no, to attend our patients na walang matatawagan, but maybe you need to strengthen that. So moving forward, siguro Sec, hindi naman kayang lahat i-accommodate ng Department of Health. I know, no. In fact, devolved po ang health, no. Naka-devolved supposed to be mas strengthened dapat sa ground. Siguro lang ay tulungan po natin ang ating local government units, no, to follow ano talaga yung dapat ginagawa nila, function at this time. We're talking on COVID patients lang ngayon, but what about the non-COVID patients? Yun yung, I think, malaking problema natin ngayon. We have available isolation facilities. Kanina sa presentation ni Sec Villar, he said there were like 23,000 isolation facilities already built, and we have like ICU infrastructures or facilities soon to open. Can we hear from anyone, from Yusek Vega or Secretary Mark or anyone?
Ma'am, prior to that, if I may be allowed to just very quickly give my rejoinder to some of the points that you have very well spelled out. Number one, yung pong One Hospital Command is now planning to expand into becoming a one COVID referral network, no, para talagang the whole system of delivery of the healthcare services ay integration nung system. So from the lower level facilities, beginning with the births, beginning with the isolation treatment facilities, to the infirmary, to the district hospitals, level 1, level 2, level 3. And so yan po ang gagawin, but it will actually require much more navigation, a much more sophisticated navigation system, and also coupled with a database management system. Ano po? And corollary to that, under the Universal Healthcare Law, yung primary care facilities, no, should really is being pursued. Ano, nagkaroon lang ng konting aberya because of the COVID-19 pandemic. But this is one of the immediate deliverables under the universal healthcare law. And so once we are able to roll out many more primary care facilities, tingin ko ito po ang magiging strategic solution to this problem.
Yusek Bong, additional question, are you considering at least at the regional level magkaroon tayo ng command center also?
Yes, ma'am. That's what we are trying to do right now, specifically because we have seen the rise in the number of admissions and referrals here in NCR. And we actually already set up the regional one hospital command in Region 3 and Region 4. And this is also the pathway that we can do coordinated care and referral to these regions. So at the moment, we are also planning to set up one in Cebu and in Davao to make sure that we are all connected. But the IT infrastructure that we should have must be upgraded so that we will have a better telecommunications.
Thank you, Yusek. Do you have dashboard right now monitoring yung capacities?
Yes, ma'am. The op center that we have in MMDA, we have a dashboard. We can actually see all the hospitals on a granular level, even down to the provinces, the beds, the occupancy, and some of the TTMFs that are being used and are not used. So we do have a dashboard, ma'am.
Yusek, kasama po ang private hospitals doon. Are they required to submit real-time yung available and occupied beds nila?
Yes, ma'am. All public and private hospitals, they're mandated with their own data managers to make sure that they encode the daily, every 4 hours at this time, the current and timely updating of their occupancy and vacancy. So both public and private, they do it, ma'am. And we have the dashboard on there.
Okay, thank you, Yusek Vega. Next to ask question is DSBH. Yusek Vega, ang DICT po ba tinutulungan kayo? Setting up like a call center na yung one hospital command?
Yes, ma'am. In fact, we have already asked DICT to connect our fiber optics with them. But we are based in MMDA. And the fiber optics of DICT is across the MRT line. So it took time for us to make sure that we get the necessary permit for DICT to connect their lines with the lines of MMDA because it's on the other side of the MRT track. But we already got the permission of course, the MRT and the different concessionaires of the MRT that we will cross the fiber optics towards MMDA. We're now in the process of doing that, ma'am.
But kasi merong sense of urgency to, can we just use like cell phones? You can just provide your manpower cell phones na pwedeng ma-access kasi yun din USEC yung pinaka-accessible. And
yes,
then from the province, sir, platform na ginagamit nga nila, Facebook eh. Mas mabilis sa kanila nagme-message sa Messenger. So we can use other platforms pa.
Yes, ma'am. Once we will have the PLDT upgrade, the IP will be there in terms of the internet capacity, and we will have call forwarding calls and definitely an internet capacity wherein we can do messaging through Facebook or other social media.
But Yusek, kailan po ang target ninyo na ma-achieve yung mga lahat ng mga plano na ginagawa po, na iniisip po ninyo?
Honestly, ma'am, we want to achieve it now because that is the demand of the public. But the limitations is that we need to have the access from PLDT and the hiring of new personnel. But as soon as we do this, I think the better it would be in terms of the response towards this pandemic.
I hope the ICT will help you on that, no? So we can expedite yung strengthening natin and expanding yung services po ninyo.